Good morning. Welcome to Cuddles and Milk, Petaluma today. Thanks for joining me. Today is a Breastfeeding Journey, episode 7. So today is Monday, October 19th, and I'm talking about common problems today that you might face in the first month. So in our Breastfeeding Journey Facebook Live videos, I've kind of gone from that beginning, right before baby can be born, to birth, hospital days, first few weeks, establishing a supply. Now we're going to talk about common problems and how to know when to get help. So this is a big question because when it's your first baby, how can you know what's normal and what's not, right? As a mom, you might have heard it hurts to breastfeed. So you might think nothing of the fact that, for the first 2 or 3 weeks, your nipples are raw, cracked, bleeding, really, really tender. Toe curling pain, sometimes I'll hear mamas say, or that it, takes their breath away the first minute or two of nursing every session. All of that's not normal. Let's just start right there. Breastfeeding should not be painful. I'm going to say it again so everyone can hear me. Breastfeeding should not be painful. Tender, maybe a little. Weird, slightly uncomfortable even. Painful, no. It should never be painful. If you are curling your toes, if you feel like you are tensing and getting like this, ready to breastfeed, or that's how you spend the first few minutes of each session, that's not normal, okay? That is not how it's supposed to be. That is not how our bodies are designed. That is not how breastfeeding is supposed to be for you and baby, okay? And I won't even get into all the things that can create about skin breakdown and mastitis and how the baby's not using their mouth right, or you can even release a ton of stress hormones like cortisol. We won't even go there today. We're just going to say, not normal, get help. Okay, so that's the first thing, is having your nipples be a little sore is okay if they're just tender, not painful, and just a little bit when you first get the baby on, a couple of seconds. But it doesn't make you cringe. Your nipples aren't sore in between the feeds. If you're not wearing a bra and you're wearing a shirt and it rubs, it's not hurting. All of those things, like as long as it's just a tiny bit, that's okay. But it really shouldn't be painful, okay? So there's definitely that line between tender or maybe even uncomfortable and painful. Painful is not okay, okay? If it's painful, we're creating nipple damage, the baby's not latching correctly, they're not using their mouth correctly. We need to fix that, okay? So that's when you need to get some help. And so now you've figured out you need some help, okay? What are you gonna ask? I mean, how do you know if they know what they're doing, right? How do you know? So I would say the big thing is when you look for help, the first thing is to get an IBCLC, okay? So that means an internationally board certified lactation consultant. All right, that is what we call the gold standard. It is the top of the line in lactation that you can have internationally. So that means anywhere in the world I can practice under this license. It means I've had the most education possible, not just like a weekend course or even a week-long course in lactation. I have a background in health classes on some of them. Some people take them just these health courses. I, and like many other lactation consultants, was a nurse first. So I have my bachelor's of science in nursing, and then I took lactation specific courses, and then I had at least 500 practice hours in lactation, okay, before sitting for my international board. So you want to make sure you're getting somebody that really knows what they're doing. So start there. And then I would ask them what their training is or what their experience is with oral assessment. So if you're having really painful latch, really sore nipples, that's coming down to having a bad latch, okay? That's coming down to the baby is not latching correctly. So that's either mom, baby, or the way the two of you come together. It's like a puzzle piece, right? How you fit. Sometimes it's mom's side. You might have flat or inverted nipples. The baby just kind of slips right off and can't get a good hold, right? Baby's anatomy might be perfect, but mama's anatomy is making it a little harder, okay? It could be baby's anatomy is off. Baby's got a real tongue tie, cannot get that tongue out to scoop the breast and pull it back in, can't use their mouth properly, okay? And it can be the opposite, or not opposite, but it can be in between. It can be how the two of you fit together. It can be that, you've got shortish nipples, or a baby that has a tongue that can kind of move but not fantastic, and you're both in between, but the way you fit together doesn't work. Okay? So it can be all of these different things, but I talk about the oral assessment because it's so huge. I see it so often, and I actually see it missed a fair amount of time, frequently from pediatricians, but sometimes even from other lactation consultants. The big thing to me is, how is that baby moving their tongue, right? Can their tongue move properly during breastfeeding? Okay, and I had 2 babies last week that I saw that when I put my finger under their tongue to lift it up slightly, their tongue dipped in the center. So instead of it being round out here, it went like this, out, dipped in, and then back out. It was almost like a fork or a heart-shaped tongue. That's really not normal, right? That's such tight tension on the tip of the tongue that it's literally pulling it back, and the tongue can't even be rounded at the tip. So that's a really common, and I'll have a whole nother, I think I have a whole series on tongue ties, so you can look into that if you want. So that's a big topic, and I could spend weeks talking about it. But I'm just touching on it briefly today to say, when you are having sore, painful nipples, okay, then you need a good oral assessment, because the latch is what's causing it, and you got to figure out why. So you need someone who can get in there and look at the baby's mouth and go, okay, this is what's going on. Or no, baby's mouth is totally perfect. Maybe it's positional. Maybe we're just not getting a deep enough latch. But they need to be able to know that, okay? So that's a really common problem the first month, is those sore nipples, okay? Another common problem I'll just lightly touch on is weight issues for baby, all right? When the baby is not gaining enough. And so when that happens, sometimes we start the supplementation, like the pediatrician will say, okay, I want you to give a bottle of formula after each breastfeed. So the downside with that is it starts this whole cascade, this whole domino effect, where baby is now getting extra food, but your body doesn't know that. So your body's not making any more food. So you really need to be pumping. And then baby gets used to the bottle, and baby doesn't want to go back to the breast. There's this whole thing that can happen. So how do we get around that, right? What do? There's so many other ways, all right? We can use a little cup to feed baby, where we go like this, and we just use this little cup, and baby just kind of laps it up. We can use a tube at the breast or a tube on your finger. We can do a paste bottle feed. Like, there's so many other ways we can get mama pumping. But if weight is an issue, okay, if you've been to the pediatrician and they're saying, baby's really not gaining enough, I'm a little bit worried, you need to supplement, definitely find an IBCLC if you want to breastfeed, because right there you're already at a spot where you're kind of breaking that chain of easy breastfeeding, and we need to get you back on track. And we need to make sure baby's gaining enough and your supply is protected. So we're of course going to feed the baby, but there's lots of ways to feed the baby that don't affect mom's milk supply, and that can protect mom's milk supply and get baby back to the breast. So just because we're all going to feed the baby and make sure baby's health and safety is a priority, that doesn't mean we're all doing the same thing. You know, if the pediatrician's saying give the baby an ounce of formula after each breastfeed, and doesn't tell mama to pump, and doesn't tell mama to paste bottle feed, doesn't talk about what type of nipple to use on the bottle, all these things, that's not going to be as good for breastfeeding as if a lactation consultant says, okay, we're going to get you pumping. We're going to either use a tube at the breast, or a paste bottle feed, or even a cup feed. We're going to explain how to do all these things. It's different. Okay. So we really want you to protect that supply as much as possible and to get the baby gaining. So those are times you absolutely want to reach out for help in the first month if you're having any sore nipples, right? If we're painful at all, remember, breastfeeding should not be painful, okay? So if you're in pain, if baby's not gaining, those are really common. Those are when you reach out and get some help, okay? So thanks for checking me out today at Cuddles and Milk in Petaluma. I'd love it if you went to my website and learned more about my visits or my practices. If you have any questions on tongue tie, I've got a whole page on that with lots of resources that you can look at, and some other great articles and such. So cuddlesandmilk.com. All right. Thanks so much for joining me, and I'll see you next week.